Hi everyone, this sexual communication presentation is brought to you by Titanwell. Titanwell is the health promotion services at Cal State Fullerton. I want to also mention that this is a safe space for everyone and we will be discussing more sensitive topics. So let's begin. First, we have a pretest. You may pull it up on your browser by either typing in the link or by scanning the QR code with your phone's camera. This is just to gather your prior knowledge before the presentation. It should take about 3 to 5 minutes. Who we are. So this slide is just to reiterate who we are at Titanwell. So we are Titanwell's peer health educators here for you. We work with students to help empower themselves to make healthier decisions during their time in college as well as in their future. We don't tell students what to do, but instead provide Titans with the knowledge and resources to help and encourage those healthy choices. We also work with the professional staff at the Student Wellness Center to provide students with the most up-to-date information, whether that is through our presentations, handbills, social media posts, and anything else that we are presenting to our Titan community. And we are students ourselves, so we go through the same struggles as all of you, and we are all in this health journey together trying to make healthier decisions. This is a brief overview of what the presentation will be covering. So we'll be going over the different types of relationship structures, consent as an acronym, common assumptions and barriers to sexual communication, sexting and dating apps, as well as tips on how to utilize these safely, active listening, making requests, destructive tactics, and then end with some resources both on and off campus. Communication 101. Communication is important for all types of relationships, whether that be with friends, significant others, family members, supervisors, coworkers, classmates, peers, and all other types as well. It is a two-way process that involves both sending and receiving messages. Effective communication, both verbal and nonverbal, can even improve interpersonal relationships and is needed for long-lasting relationships. Before I move on, I want to ask you all, what is mutual empathy? Throughout the presentation, we will have more interactive components just like this one. So I bring that up because the most important element in communication is mutual empathy. This is where we try to see things from a different point of view and try to understand their perspective a little bit better. Empathy is feeling with the person, compared to sympathy, which is feeling for the person. So in this presentation, we will be discussing specifically sexual communication. Consent. So we like to think of consent as an acronym of consent phrases. Before I continue, which phrase demonstrates consent best? Okay, so now let's define consent. F is for freely given, so it is not coerced or pressured into giving consent for any type of sexual activity. R for reversible, meaning although it can be given, it can also be taken away at any point engaging in sexual activity. I for informed, so all participating parties are aware of the activities that will take place and have asked all pertinent questions regarding STI status and testing, birth control and barrier protection methods, and any other important information. E for enthusiastic. Consent is given with a positive and enthusiastic yes. It is not just a sure or an okay. S for specific. It is given for specific sexual behaviors that will happen and continually given for all others. For example, it can be given for oral sex, but not for anal sex. And then lastly, S for sober. No alcohol or drugs are in anyone's system because it is impossible for a person to give consent if they are intoxicated. Communication and sex. Communication is important for all types of relationships, as we mentioned in the Communication 101 slide earlier. For sexual relationships, good communication reduces the risk and increases the pleasure. So it reduces the risk by starting those conversations around STI testing, using birth control and barrier methods. So then this will reduce the risk of STI transmissions and also any unintended pregnancies. It increases the pleasure by having open communication about boundaries, what all participating members like and don't like, and increases everyone's overall enjoyment. So starting those conversations about sex with your partner or partners can be a bit difficult and scary, but we will give you some tips throughout the presentation that will hopefully make sexual communication a bit easier. And remember, it is always important to keep in mind these healthy communication methods. Healthy discussions, healthy planning. So it is important to be prepared for sexual intercourse before it happens. So in sexual relationships, you may have to negotiate to set limits on sexual behaviors, desires, and boundaries. So knowing what you like and don't like, as well as any desires that you may or may not have. Next is deciding on what birth control methods to use. So you want to be informed on what you, your partner, or partners, and the birth control methods they are on, and if they are taking it efficiently. Then figuring out how to protect from STIs and HIV. So this means whether you are using barrier protection methods, such as internal or external condoms, dental dams, or preventative measures against HIV. And then disclosing your testing and sexual history. So we always say to disclose the testing history, but the sexual history is up to the individual. It might not be necessary to say how many partners you have had, but if you and your partner or partners are in a space that you feel it is important, then we do recommend talking about sexual history as well. Next, we will be discussing dating as a college student. Relationship structures. So here are a few different types of relationship structures to familiarize yourself with. First, we have mutually monogamous relationships. This is where both partners are in an understanding that they only have sex with each other. In this type of relationship, it can reduce your risk of STIs because you know you are only with one partner and you can keep accountable for testing status. The next one, asexual or non-sexual relationships. So this means generally sex does not occur, but it can be either completely or selectively abstinent, depending on the individual. So this could mean you may engage in certain types of sex, but not others. Open or non-monogamous relationship. This is where it is a consensual, honest monogamy, such as casual dating, swinging, and polyamory. So I'll define a couple terms here. Swinging is having sex with other partners, together or apart. And before I tell you all what polyamory means, what do you all think it means? So for those of you that may not know what the term means, polyamory is when you have one primary partner, and then you have other partners to fulfill other needs. And then lastly, we have friends with benefits, where generally there is an agreement to have sex with another, but the relationship is not romantic, but instead a platonic relationship or friendship. Sexting. So sexting is a form of safe sex because there are no direct risks of pregnancy or STIs associated with it. But it can have long-term effects socially, so we do encourage these sexting tips. Know your boundaries. Make sure you know if you just want to text or talk, send photos, and then what is okay and not okay to be discussed. Know what's in your photos. If privacy is a concern, know what's in your surroundings. So make sure to be mindful of any identifying factors that are including your face, tattoos, also anything in your background. So family photos, school names, or whatever it may be. Know who is receiving the photo. So make sure you check the recipient and you are not sending it to a family member by accident. And then make sure you know the person you are sending it to and you've met them either physically or over a video chat. Be sober. Sometimes it can sound like a good idea to send a sext when you are intoxicated, but make sure you are sober if you do send something so that you don't regret anything after you've sent it. And be aware of misinterpretations. So, texting in general can have a lot of misinterpretations in tone. So, make sure it is not your only means of communication, or you are very clear about what is being sent and the communication that is happening. Dating apps. So, here are a few dating apps that we know of. What other dating apps do you all know of that are not pictured on this slide? In the next slide, we are going to go over some tips of what to do and what not to do on these dating apps. So, dating apps. Dating apps are great whether you are looking for relationships, friendships, or just casual sex. Being honest is important and is a great way to practice healthy communication if there was a relationship to occur from a dating app. So, here are some tips. No real phone numbers. So, make sure that you are using the app as your way of communication and not using your real phone number, just in case you might not want to talk to them anymore to avoid any uncomfortable situations. Social media account awareness. This means to be aware of linking your social media account. A lot of times people do this to make it seem like they are a real person, but it can lead to someone learning more personal things about you. So do keep an eye out on who you are sharing your social media accounts with. Let a friend know. This relates more so to if you are going to meet someone in person. So letting a friend know where you are going. Maybe even sharing your location through an app, just so in case something doesn't go like how you wanted it to, your friend can always pick you up. Meet in public. So don't meet at anyone's house or apartment on the first date. It's important to meet in public in a somewhat populated area, just in case something does not go as planned. Drive yourself. This also relates to if it doesn't go as you expected, you can always drive yourself home and you're not relying on someone else for transportation. And then don't be afraid if things don't feel right. Sometimes the date doesn't go how you expected it to go, and it's completely okay to admit that. Sometimes it does take a while for something to go right, so you can always try again later. And it's okay to communicate that it's not working out and leave the date early. Assumptions. These are a barrier to effective communication, especially in sexual relationships. Here are some examples of assumptions that can be made in sexual relationships. Your partner has been tested for STIs. So this puts yourself at risk because if you are assuming your partner has been tested and they haven't, you might engage in unprotected sex, and if they are positive for an STI, then you have just put yourself at risk. Your partner is on birth control. This assumption can put you at risk for unintended pregnancies if you do engage in unprotected sex while assuming they are on birth control or if they are taking their birth control. Your partner knows how to properly use a condom. So this typically happens to individuals with penises that it is assumed they do know how to use a condom properly, which can lead to less effective condom use. So it's important for all participating members to know how to use a condom properly. You and your partner are monogamous. This might be a difficult conversation discussing if we are only seeing each other or if we are seeing other people as well. But having this open communication about who we are having sex with is important and can lead to discussions about STI testing and birth control methods. And these assumptions can be avoided by increasing sexual communication. Barriers to communication. So just like assumptions, there are many other barriers to communication, especially when it comes to sexual health. Sexual communication can be difficult because there might be a lack of role models, there might be a lack of comprehensive sex education. So before I move on, why might a lack of comprehensive sex education be on this list of barriers? So although we go to school in California, depending on where you are from, your sex education can differ tremendously. So it's important to keep that in mind and be clear on what you want to communicate to your partner. Others might not know the same sexual vocabulary as you do. So also having these conversations can also trigger a variety of emotions, including shame, guilt, fear, and anxiety, due to a stigma that surrounds sex and sex education, making it a bit more difficult. There are also a lot of negative beliefs about sex and with privacy in general. This topic is very taboo in a lot of different cultures and spaces. And lastly, ethnicities and cultural differences can cause sexual communication to be a bit more challenging. Next, we'll go over why sexual communication is so important. Sexually transmitted infections. So here's a statistic that we like to put in all of our presentations because of how important it is. 1 in 2 sexually active young people will get an STI by the age of 25, and most will not know it. So this is not used as a scare tactic, but instead to demonstrate the importance of getting tested regularly. The last part, most will not know it, is because a lot of STIs are asymptomatic in people, meaning that they do not show any symptoms. Another takeaway is to get tested regularly. So what that looks like is every 3 months, or with every new partner, whichever comes first, for non-mutually monogamous relationships. And for mutually monogamous relationships, it means every 6 months or once a year. How can I avoid an STI? So here we have 3 tips on how to avoid an STI through communication and other methods. The first tip is being mutually monogamous. It may not be ideal for everyone, but it can reduce the risk by only limiting your exposure to one partner. The second tip is to use a condom and other barrier protection methods, such as internal, external condoms, or dental dams. And regardless of birth control methods, condoms should be used to prevent STIs, because although being on birth control pill or having an intrauterine device will prevent unintended pregnancies, it will not protect against STIs. And the last tip is to get yourself tested regularly and share your results with your partner or partners. And just a friendly reminder, getting tested regularly is every 3 months or with every new partner, whichever comes first, for non-mutually monogamous relationships. And for mutually monogamous relationships, every 6 months or once a year. Next, we'll go over what you should ask before having sex. So here are some questions that you should ask before having sex. What sexual activities are you comfortable with? So that means, what are your boundaries, likes, dislikes, and things like that. So this helps to create a safer environment for all participating members. Does any sexual activity make you feel uncomfortable? Again, this emphasizes creating those boundaries and having clear and open communication. Is there a sexual activity that you prefer or dislike? This also helps to make an overall more enjoyable experience for everyone. When was your last STI and HIV test? This question can help decrease the risk for STI transmission and bring up the conversation about barrier protection methods as well. Have you had any STI symptoms? A lot of STIs can be asymptomatic, meaning that they do not show any symptoms, which is why it is important to get tested regularly. And in some cases, people do have symptoms, to where they should be tested, but they have not been tested. Are you under the influence of drugs and/or alcohol? When a person is intoxicated, it is impossible for them to give consent, which is why sober is one of the key aspects of the consent acronym. What method of STI/HIV protection will we use? So this question focuses on barriers such as external internal condoms or dental dams. STI and HIV transmission are separated because STIs and HIV are different when being tested, but are also different in the lifespan. HIV is treatable, but not curable, unlike most STIs. Are we exclusive? Being mutually monogamous is a helpful tip in avoiding STIs. However, it may not be ideal for everyone, but it can reduce the risk by only limiting your exposure to one partner. And what about birth control? It's important to know if your partner is on birth control or taking birth control effectively, which can lower the risk of any unintended pregnancies. Active listening. When our partners are asking all of these pertinent questions about serious and sensitive topics like sex, just like how we mentioned in the previous slide, we need to make sure to actively listen to show that we do care. So here are some ways that demonstrate active listening. Eye contact. Make sure that our phones or other distractions are put away or on pause so that we can focus solely on the person talking. Posture. Making sure our body language is showing an opening and welcoming posture. Provide feedback. Make it evident that you are listening, whether that is nodding along as they speak or reflecting on what is being said and asking questions with paraphrasing, such as, "What I'm hearing you say is..." Defer judgment. Provide a safe space for your partner to speak freely, and don't interrupt with any counter arguments that you may think of, and just allow the speaker to finish. Respond appropriately. Now that your partner has openly communicated, be honest in your response and assert your opinions carefully. Discover your partner's needs. In order to find out what your partner wants, all you have to do is ask. So here are some different types of questions to ask. First are closed-ended questions. These are the least informative and least helpful, because a typical response is either with a yes or no. An example for this is, "Did you like that?" Next are either/or questions, which are a bit more informative and contain less structure, allowing the other person to choose from options. For example, "Do you like this or this more?" And lastly, we have open-ended questions. These are the most informative and have the least structure because it typically requires more than one-word answers. For example, "What do you like?" What is another example of an open-ended question? Next, we will move on to making requests. So it can be difficult, but with practice, it can make it easier. Making requests is important so that you are taking responsibility for your own pleasure. Our partners don't always know what we want, so making sure we are openly communicating. Expecting them to read our minds can cause problems, such as our expectations might be let down. And always be prepared. If we want something, we need to be prepared to ask for it. What could help with this is practicing with a trusted friend, rehearsing in front of a mirror, or even writing it down. How to make requests. So here are some tips on how to make specific requests to our partner. Be clear and concise, avoiding any vague words. We may know what we want, but our partners can't read our minds. So make sure to communicate clearly so they can understand. Use I language. If you are speaking about your own experience, you should refer to yourself and not the other person. Both partners need to be satisfied for the relationship to thrive. Provide honest feedback. This can improve sexual pleasure by communicating what you liked and maybe what you didn't like as much. This also makes sure that your partner knows you are listening and that you care. It does take time to overcome what we were taught, so be patient with yourself and with your partner, and avoid any passive aggressiveness. Destructive tactics. So we all use destructive tactics in some form, but the goal here isn't to tell you not to use these, but instead just to be more aware of the methods of communication that you are using and how they can be misinterpreted by other people. Here are some examples of communication that does not work. Criticism. This is different than offering a critique or complaint and is often viewed as a personal attack. Contempt. This is where someone is treating others with disrespect by using sarcasm, ridicule, and/or body language, such as eye rolling. Defensiveness. These are efforts to defend yourself while ignoring your partner. It's important that although we may feel the need to defend ourselves, to make sure that we are practicing active listening and communicating what you may be feeling. Stonewalling. So rather than confronting the issue with your partner, we tune them out, which can be shown through our words and/or body language. Summary. Communication is key to any healthy relationship, whether that is with your family, peers, coworkers, significant others, etc. It involves both sending and receiving messages, and the most important element is mutual empathy. Overcoming barriers can lead to a long and lasting, healthy relationship. Positive communication can help decrease the risk of unintended pregnancies and STIs, as well as increase the sexual pleasure by having that open communication with your partner. Remember to use I statements when making requests, along with being clear and concise, so avoiding any vague words. And lastly, avoid destructive communication tactics that we mentioned in the previous slide. Communication about sex can be difficult, but with practice and knowledge, it can become easier. So it is always important to keep these healthy communication methods in mind. So now we'll go over some resources both on and off campus. Family Pact. So this is a state-funded program, meaning it only works in California, that provides family planning and family planning related services to those eligible at no cost. If an individual meets the eligibility requirements, they will have access to free STI screening and treatment, HIV testing and counseling, pap smears, emergency contraceptives, birth control options, and other services. At CSUF, we also have a family planning specialist at Student Wellness. Feel free to make an appointment if you have further questions. Condom and special barrier requests. Here at Titanwell, we have a condom availability program, which offers free lube and barrier protection methods, such as external-internal condoms and dental dams. CAP offers 4 options, including 3 pre-packaged options and 1 customizable option that you can choose from. Place your order for pickup by scanning the QR code or using the link located at the bottom of the slide. You will then receive an email confirmation when your order is ready for pickup. CSUF resources. Here are just some of the resources that CSUF offers. So we have Student Wellness, Diversity Initiatives and Resource Center, also referred to as DIRC. So this provides support to the Titan community to expand their cultural competence and identity development. Titan Recreation, also known as the SRC, Division of Student Affairs Women's Center, Tuffy's Basic Needs Services. So this provides students with support via food, short-term housing, hygiene products, clothing, and emergency grant funds. Associated Students Incorporated, which is the student leadership on campus. Titanwell and the Titanwell Hut, educating and empowering students to make healthier decisions. Sexual health resources. Here are some website links if you all would like more information on student wellness, counseling and psychological services, Titanwell, Centers for Disease Control and Prevention, Go Ask Alice, which is an online Q&A for all the sexual health questions that you may have. Bedsider, which is an app that allows the user to compare 3 birth control methods at once on a chart, as well as testimonials from people who use birth control. And Yes Means Test, which gives more information on STI testing. We also have a health educator at Cal State Fullerton who does one-on-one appointments for sexual and reproductive health. So feel free to DM your questions and comments that you may have to our Instagram at Titanwell, or check out our website for more information. And lastly, we have a post-test for you all to complete. You may pull it up on your browser by either typing in the link or by scanning the QR code with your phone's camera. This is just to gather your knowledge after the presentation, and it should take about 3 to 5 minutes. So I want to thank you all for engaging and listening along to this sexual communication presentation, and I hope you all have a great day.